One of the most prevalent ways that we know that a woman has gone into labor, as far as Hollywood goes, is when her water breaks. A lot of times it's kind of like, oh, surprise, my water just broke, and now all of a sudden I'm in labor and it's going crazy fast, and the baby's going to be here in 10 seconds, so we have to run to the hospital. The chances of that happening are very low, about 15%. So we need to be prepared for the other ways that our water can break. One of those ways is a premature rupture of membranes. Um, Another is the artificial rupture of membranes, where your doctor actually ruptures your membranes. And obviously, the spontaneous rupture of membranes, which is the surprise, the water just broke. All of these ways happen quite often, as far as getting your baby here safely. So we're going to discuss them just briefly. First, we'll talk about the premature rupture of membranes. It can be a little scary because oftentimes either you're not quite to term, or you could potentially be quite early, and that can always be very nerve-wracking. If you have any history of preterm labor, this would be something that you want to talk about with your doctor right away at one of your earlier appointments, just so that you can have a plan in place and feel more confident about what's going to happen in the future. So you have a couple of options as far as premature rupture of membranes. You can go to the hospital. Obviously, you need to call your doctor right away if this happens. It's extremely important. Call the nurse line, call the hospital, get their opinion. They'll probably have you come in, check to make sure it's actually amniotic fluid, and then they'll either, depending on how far along you are, they can give you some steroids to prep the baby's lungs, to get ready to have a premature baby. Or they might also give you some drugs to stop labor, depending on how far along you are. Probably somewhere in the realm of 28 to 34 weeks, they'll probably try to stop the labor as much as possible, just to give the baby more time to develop so that they can be more ready for the outside world. All of that is done in the hospital, and all of that needs to be discussed with your doctor as soon as possible. That's not something that I would suggest playing around with, just because it can be a very precarious situation having a preterm baby. The other option for your water breaking is the artificial rupture of membranes. This is when usually there's two times when this would probably happen. You've either been in labor for quite some time, and your doctor feels like, hey, let's break your water and try to get things going a little faster. Basically, what happens when your water breaks, the baby's head is pushing on your cervix more, so it can often feel like a lot more pressure. Maybe your contractions feel a little bit stronger, but it also usually helps open up your cervix and helps the baby come down. They can also rupture your membranes to begin labor. So that's another option as far as induction. If maybe you've tried the Foley bulb, maybe you're already 3 to 4 centimeters dilated, and your doctor feels like, hey, let's just give this a shot. That can be another great option. It can also be a great option for a woman who wants to have her baby naturally without medications or interventions, just because, I guess I should say any more interventions, because obviously this is an intervention, but it's a low intervention, and it can also help you to have the baby naturally without medication, if that's something that you are interested in. The last one is the spontaneous rupture of membranes, and that is just, you stand up from bed one day and you hear a pop, and all of a sudden it feels like you peed your pants, and it's go time. It's time to have a baby. Usually this happens between 37 and 42 weeks, to kind of, your body's just preparing, and this is just the way that your labor has begun. Like I said before, it doesn't happen in nearly as high of numbers as we might expect from watching Hollywood movies and just, hearing stories from other people. One thing that does often happen is your amniotic sac can tear a little. Instead of a big gush, it kind of feels like a slow trickle. And what we suggest doing is laying on your side, getting up, laying on your side, getting up. Trying that a couple of times, giving a couple minutes between there, just to see if it actually is your amniotic fluid. A lot of times your bladder control isn't as great during your third trimester, so having that little bit of reference can be helpful too. And in that case, you would just want to call your care provider, see what they want to do. You can obviously decide for yourself, if you want to stay home for a little while. If your care provider wants you to come in, that would be something that you would want to discuss with them. So those are all of the ways that your water can break. Good luck.